Dr. Ken Landau. Thanks for watching. Let's talk about Taltz. Taltz is a new drug used to treat psoriasis. Now, it's not just any psoriasis, but it's psoriasis that's pretty bad. We call it at least moderate to severe psoriasis. It was approved in Europe in January of 2016, in the United States in March of 2016, and it's just an antibody to a chemical known as interleukin 17A. It blocks the effect of 17A stimulation. So what does that mean? Well, if we can do that, it will cut down on the inflammatory reaction in the skin, and it will cut down on the skin cell proliferation. Well, that's what psoriasis is. It's injected at home underneath the surface of the skin. It's estimated right now somewhere around 125 million people throughout the world have psoriasis, with maybe 1 in 6 suffering severe enough disease to potentially warrant this kind of therapy. Psoriasis tends to start in relatively young people between the ages of 15 and 35 and then persists forever. It was evaluated, this drug Taltz, in about 4,000 people and found to be about twice as effective as Enbrel, a drug you hear advertised quite frequently. Well, in order to take this kind of a drug, you should have at least 10% of the body's surface area affected with psoriasis, but it's only 5% area of the hands or the feet or the face or the genitals that would make you a candidate. It's injected as a double dose to start, and then a single dose at weeks 2, 4, 6, 8, 10, and 12. That's every other week for the first 12 weeks. And then it's injected as a single dose once a month. Now, you store the product in the refrigerator. You get it out about a half an hour before you're going to use it. You inject yourself in your upper arm, in your abdomen, or in your thigh. Seems like you get the best result if you inject in the thigh. It comes as an auto-injector, so it's relatively foolproof. But if you have an area of redness or soreness where you plan to inject yourself, hey, go pick a different spot. It's slowly degraded in the body, so it's broken down about 50% after about 2 weeks. So long half-life. Doesn't seem to cause cancer, doesn't seem to cause mutagenicity or abnormal cells. We don't really know whether it's safe for women who are breastfeeding or for women who are pregnant or for children less than age 18, so probably not a good idea for those people to be taking the drug. Side effects, well, relatively minimal. You can have an injection site reaction. You had a needle stuck in you, so you could get some redness and some soreness. It can increase the likelihood of infection, so you could get some conjunctivitis or some candida in your mouth or fungal infections. And it's a good idea to get a tuberculosis test before you take the drug and probably once a year thereafter. Now, some of the drugs in the family of Taltz, but not Taltz itself, at least so far, have been associated with heart attack and stroke. Are there substantial side effects? No, but there are a lot of little minor pesky side effects that may occur in a substantial number of people, the most important of which, however, is that the white blood cells, the cells that fight infection, are decreased in a significant percentage of the people. About 1 in 10 who take the drug are going to have a lower white count, and the platelets, those things that make you stop bleeding, are decreased in about 3% of the people. Well, after you take the drug for about a year, it seems that about 1 person in 5 is going to develop some antibodies to the drug itself, and that might inhibit the drug from working in about 10% of those people. So about 2% of the people overall taking the drug might find it's less effective over a longer period of time. And some people can get an allergic reaction. Maybe they feel fat, or they have some puffiness or some swelling of the face or the eyelids or the neck. They can have a feeling of tightness in the chest, or at some point, they might even have some difficulty breathing. Well, you shouldn't take the drug if you have any kind of symptoms or signs of potential infection. So if you have an elevated temperature, if you have a cough, if you have muscle aches, if you have shortness of breath, if you have weight loss, if you have some diarrhea or some pain in your stomach, or if you have difficulty urinating or pus in your urine, don't take the drug. And also, you shouldn't take the drug if you happen to have inflammatory bowel disease. That's Crohn's disease or regional enteritis or ulcerative colitis. It's not for use in those people who are going to get a live vaccine Fortunately, we don't use too many live vaccines anymore, and it's not for women, like I said before, who are either pregnant or are nursing. We don't know the effect on the liver, we don't know the effect on the kidney, but we do know that as far as psoriasis is concerned, this is a phenomenal drug. Seems like after about 12 weeks, 40%, almost half of the people taking the drug, are going to be completely clear. And if we look at 75% improvement, it's probably going to be somewhere around 85 or 90%. Now compare that to Enbrel, where the results are only half as good, and as a matter of fact, complete clearance tends not to occur with Enbrel, but like I say, about 40% of the people taking this drug, Taltz, are going to be completely clear. Now, if you're completely clear after you take the drug for 12 weeks, and if you stop the drug, it seems the psoriasis doesn't flare up for about half a year. They originally thought that this drug, the company that makes it, thought it was going to be a billion-dollar seller, and it might because of the cost. But it's fighting against Cosentyx, and Cosentyx has approval not just for psoriasis, but also has approval for psoriatic arthritis and ankylosing spondylitis. And the drugs seem to work the same. They seem to have about the same kind of effect. Well, to some extent, who's going to win the battle? One, whoever advertises more, and there are tens of millions of dollars being spent on ads for these two drugs. But it's going to basically boil down to what's easier for the doctor to prescribe, what's easier for the patient to get, what's the approval process. Because the drugs are so expensive, you have to take other drugs first and fail at other drugs. So methotrexate or PUVA therapy. Or maybe if you have substantial enough disease, you should take Otezla or Humira or Enbrel or Stelara first. And only if you fail those therapies, then should you consider either Cosentyx or Taltz. Now, according to the British government, if you're not at least 75% improved after 12 weeks, you shouldn't continue with this drug. How much does the drug cost? A lot of money. A whole lot of money. So if you went out and paid cash for it, for the first 12 weeks of therapy, it's going to cost you about $33,000. And if you take it for the rest of the year, it's going to cost another $37,000. So the yearly tab for taking this drug that you see advertised so blithely on the television, the yearly toll, if you paid cash for it, would be somewhere around $70,000 to $84,000. But the drug companies say, hey, we're going to give you a little card and you're only going to have to pay about $5. We're going to stick the rest of it to the insurance company. So, bottom line, how do we rate the drug? How do I rate the drug? Well, as far as effectiveness is concerned, we'll give it an A. No question. It's a phenomenal drug. On the other hand, how do we rate it as far as the cost is concerned? Absolutely ridiculous. Here's another example where the drug company is sticking it to you. I'm Dr. Ken Landau. Thanks for watching.